My name is Morcho. I'm the president and CEO of KeraLink International. We are a U.S. not-for-profit 501c3 organization. And KeraLink has a mission or vision to eliminate corneal blindness globally. Since I was brought on over a year ago, my objective has been to develop technology solutions that can help doctors and healthcare providers in these regions, Africa, India, Southeast Asia, to increase access and affordability to provide healthcare for corneal disease and blindness that it meets world-class standards. So it's accessibility, affordability, and what we call at KeraLink, reliability.
So this is our pharmacy. So this is riboflavin,
Yes.
and it is used for cross-linking. So we'll be going to the theater in a couple of minutes to see the cross-linking process in progress.
We have a partnership with the Maghrabi ICO Cameroon Eye Institute, which is MICEI, and we have a strategic relationship with 3 hospitals in groups in Africa, 1 in Nigeria, 1 in Kenya, and our plan is to expand.
Well, I think the main benefit is that the partnership with KeraLink will help us develop our corneal services. As you know, MICEI is a subspecialty eye hospital, and so far we've been able to develop other subspecialties: retina, cataract, pediatric ophthalmology, glaucoma, and so on. But with cornea, we still have a lot of work to do. And so this partnership will really help us, corneal services.
But Cameroon is our pilot country, the first country where we're starting. We're starting a program called Diagnose to Treat, and that program is to first screen or focus on keratoconus, which is a disease that affects the deformation of the eye, the coning or thinning of the cornea, which makes it difficult for patients to see. Mostly affects younger people, usually from about the age of 7 to about 25 to 30. So what we're going to do with what we're starting to do with MICEI is we're developing technologies that first screen. So we will go in schools. We have a convention with the ministry through MICEI to screen schools and younger people and working class people, drivers at the Ministry of Transport, maybe some other folks in the public service and private service, to find out if they have problems with their eyes, including indicating or screening for keratoconus and corneal disease. When we see them after the screening, we'll use a software we've developed on the smartphones that all of our outreach teams will use to connect the patient from the outreach to MICEI. When they come to MICEI, as you have seen, there's technology in MICEI, and also some will provide, the patient will be treated. So it's a care ecosystem for corneal disease and blindness.
So when we started off with cataract and especially retina, we didn't know that the need was that high. We knew that the need was a lot, but we didn't know that it was that high. I believe that we are going to see the same thing when it comes to corneal diseases, especially keratoconus, because when people start looking, when people start actively, trying to diagnose and treat, then they discover that the problem is there. We know that it exists, but we don't know how much. It's because people are not looking.
We as a technology partner, our company that we have created, KeraLink has created a company that will work directly with MICEI as a technology partner to deliver this. For sustainability, we're also helping to train doctors. We have helped MICEI train 2 doctors to do cross-linking, 2 female surgeons, and we're going to train more people in the community, more community health workers as well. We are also working with international partners to improve funding. We will look for different types of funding, grants, direct investment, and also like impact bonds, which MICEI is an example of how an impact bond can be used to fight blindness. Already, they have used a cataract bond, which they are 3 years ahead of schedule, successfully treating cataract. They are now a center of excellence. We think something like that, like an impact bond for corneal blindness, could be very useful to also develop capacity and provide a solution to make MICEI and other hospitals centers of excellence for corneal blindness. Corneal blindness is a condition that is neglected Some people say 12.7 million people have corneal blindness across the world. But if you look at keratoconus, which affects younger people, in Africa, 7 to 8% of Africans, young people, have keratoconus. So it's potentially a bigger problem, close to even, some numbers say close to 100 million people that we don't know. The conclusion is a program like this allows a hospital like MICEI, when we come as KeraLink and our partner Corona Technologies to work with MICEI, we help them build capacity in an area that normally they would not be able to do on their own. So it's a win-win for MICEI, and for us, it's a win-win for the community, for the country, and for the Central African CEMAC region, and possibly for all of Sub-Saharan Africa.
Nowadays, to practice, good quality ophthalmology, you need technology. Ophthalmology is technology driven, and KeraLink is very, very much interested in developing technologies that will help us, detect corneal diseases very early in the community. Most of the devices that we use presently are very bulky, very expensive, and you can't easily move them into the community. But thanks to the work that we are doing with KeraLink, I believe that we'll be able to have technology that can be taken, I would say, to the doorsteps of patients, right into the community.
As an American company using innovation and coming to work with a local company, we're focusing on addressing the problem of people that normally don't get served. So we're very, very fortunate, we're very proud and very privileged and honored to partner with the #1 eye hospital in the sub-region to begin to do this program, and we're going to look to partner with other eye hospitals to develop this Diagnose to Treat program for corneal disease and blindness. Hopefully, 5 years from now, corneal disease and blindness is something everybody knows, and we're addressing it. So young children who cannot see, they cannot go to school, they cannot work, they have a chance to improve their life.